I'm Lora. I'm a breast cancer survivor and I'm happy to be here. I felt a breast lump in the evening, and so I was kind of scared and worried. Called the radiology department the next day, was able to get in and get a mammogram, which showed something abnormal. They recommended that I go have an ultrasound with biopsy. I was by myself when I went in and got my results, so at that point I was numb. It was a grade 3 tumor, which is the highest or worst type of tumor that you can have in breast cancer. I'm 45, and it was very shocking. There's no breast cancer history in my family, and I wasn't expecting it to come back as cancerous. It was also more concerning that 2 days later, as I'm trying to deal with my grief and concern, my father was diagnosed with prostate cancer, and this was right before Christmas time. And so together we, as a family, had to get through this emotional time and get our strength back, ready to fight for him and for me as the new year began. We've used Mary Greeley for everything that we've needed, hospitalizations to surgeries. That has been our place, and I totally, completely trust them. And then I heard that they were an accredited breast cancer center, and that sealed the deal for me.
We provide all of the services that are important for a breast cancer patient to receive, from the initial diagnostic imaging to appropriate pathology to multidisciplinary clinics where we talk about the patient in a group of physicians from all the different specialties, all the way through care with chemo, radiation, endocrine therapy, genetic counseling, everything. When she came in, she had several family members with her to be supportive, and it's always nice when you have a room full of people who are all advocating for the patient, listening intently to try to pick up the details of the information. We do a shorter course of radiation in our department compared with how it has been historically and how it's done at some cancer centers. There's good data that shows that this is an appropriate kind of radiation and it's more convenient for women, and so I was happy to offer her that shorter course of radiation.
I love to go watch my daughter's ball teams play, basketball, tennis, volleyball, softball, whatever it is, I'm there and enjoying every minute of it. I have been able to go and do the things that I've done before. I am enjoying life. I am back to going everywhere and doing everything that I did before this cancer came.
Her prognosis is happily very good. She is expected to continue without a high risk of recurrence.
From radiation oncology to my stays on the oncology floor at Mary Greeley, to the Cancer Resource Center, I did not meet one person that wasn't willing and caring and willing to do anything that they needed to get me better, to get me the resources that I needed, to do whatever it was to make me more comfortable. I am a breast cancer survivor, I am cancer-free, and I'm enjoying life.